Welcome to Medical Matters Weekly with Dr. Trey Dobson, presented by Southwestern Vermont Healthcare and Catamount Access Television.
Welcome, everyone. Today is April 13th, 2022, and we are recording the show for April 27th. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency physician with Dartmouth Health. And this is Medical Matters Weekly, a show about the aspects of healthcare that matter to you most. And my guest today is John Sales, who is the CEO of the Vermont Food Bank. John, welcome.
Thank you, Dr. Dobson. Great to be here.
Yeah, we're so happy to have you. Just a little bit about John's background. He joined the Vermont Food Bank in 2009, served in senior appointed positions with the state of Vermont's Department of Public Service and Agency of Natural Resources, a member of several boards, including Feeding America, One Care Vermont, and the Vermont Health Foundation, and graduated from the University of Baltimore School of Law and Frostburg State University in Maryland. What does the Frostburg term come from? I assume that's a name of someone.
It's a town. It's a coal mining town in the little skinny part of Maryland in the mountains, very close to Pennsylvania and West Virginia.
Got you. And you live in Montpelier now, is that right, John?
I do, yeah.
Well, thank you again. So we like to get into the background of our guests and learn about them personally before we sort of get into the professional aspect. So tell us a little bit about where you grew up, what that was like, and how you ended up in Montpelier.
Sure. Yeah, I grew up in Maryland, actually, from when I was about 4 years old, and my father worked for the federal government, and so commuted downtown to DC, was in the DC suburbs, and just that kind of life, kind of living in the suburbs and very much kind of middle classy, and did all the usual things. Made my way to Vermont in 2009. I was working in Baltimore doing utility regulation and came up here to work at the Department of Public Service. Had a great time working for the state of Vermont and just love Vermont. It's my home. I've been here for 22 years now. So I am, just feel really fortunate to have had a career here in Vermont and be able to do that and to do such meaningful work.
So the first part of your career was in government, and then now you've sort of transitioned a bit. Just tell us a little bit about the professional aspects.
Yeah, it was, I came up, I practiced law for a little bit and did utility law. I came to Vermont and started doing more policy work. So working at the Public Service Department, doing utility regulation. And then I moved to the Agency of Natural Resources, where I was policy and planning director and then deputy secretary. After almost 10 years in state service, it just felt like time for a change. And I knew that I wanted to continue to serve people because that's just who I am and how I was raised. And I felt very fortunate, just somebody I knew who was on the food bank board, and they were looking for a CEO and suggested that it might be a good fit. And it has turned out to be, I've been in this job longer than I've been in any job in my career, and it still feels fresh and engaging and exciting every day.
Well, that's good to hear. And also, I wanted to say thank you for your time and service at the state level in government. Did that experience, you think that shapes how you function in your current role as CEO of the Vermont Food Bank?
I think absolutely. Government, nonprofit, and business, people tend to think of them as very separate things. And my experience has been that there's a lot of similarities, and particularly in the work that I'm doing now, in trying to work for, really our goal is long-term food security for everyone in Vermont. We certainly are filling the short-term hole, but that's not the ultimate goal. And it takes government, it takes the nonprofit sector, and it takes the private sector to really create the conditions where there's stability. And if you don't understand how the public sector works, how government works, then you're never really going to be able to understand the systems that need to change. And I think my experience, both in, if you can call it a bureaucracy, I don't think that's a bad word.
Right.
But how government works internally, and frankly, how the legislative process works. I spent a lot of time over my years in government working with the legislature. There are certain ways that things get done. And, being in healthcare, you understand that. It's a very regulated, very regimented system. And if you don't understand how things get done, then it's hard to change those systems. And I think really, at the food bank here, we're in the business of systems change right now.
Yeah, I would just totally imagine that your experience helps you tremendously, not only with external credit based on your experience, but also your internal knowledge, as you mentioned, of the workings. And you yourself, you are essentially in health or healthcare as well, because food is such an essential part not only of living, it's actually an essential part to wellness, which obviously and the audience knows as well, but I just wanted to point that out. Just jumping into sort of a hard question here, hard for us, not hard for you. How do you organize the food security landscape in your mind?
You just mentioned healthcare, and I think it's been over the last 5 or 6 years more that people have reawakened to the fact that, food is the first medicine. So that is one of the ways that I organize it in my mind, is that we are really an organization that's, caring for the health of people. In the very early days of food banking, in the 60s and 70s, and really in the early 80s when it started growing significantly, it was really about what can we get donated, and then how do we just get that out the door as quickly as possible. It wasn't about food quality. It wasn't about nutrition. It wasn't about health. And that has changed dramatically. Food banks across the country are designing programs to make sure that they're supporting and improving the health of the people that we're serving. The other way I focus on food security is really food security is financial security. There's plenty of food in the grocery store. You can go to farmer's market and there's overflowing with bounty. We just have people in our communities who can't afford enough of the kinds of food that they need to stay healthy and active and participate in their communities. So when I'm thinking about how do we solve food security in Vermont or across the country, it's really about how do we make sure that everybody has the resources that they need. And you can't single out food. It doesn't have its own lane. There's people have to have adequate housing.
Right.
People need access to education. People need access to healthcare. Very expensive. And food is one of those key pieces of the puzzle. That's a basic human need. And so understanding where food fits into the puzzle and understanding that it's really an economic issue and not so much a food availability or access issue.
You touched on something I actually think about quite often, both in my role in healthcare as well as just physical fitness and wellness. And that is many years ago, before you started in this position, I think everyone still at that time understood that food was a right, but they probably thought healthy food was a privilege. And it sounds like you're trying to shift that paradigm a bit, because it's in everyone's best interest, the person that is actually receiving the food, but also society as a whole, that we focus on the health and wellness of individuals, which doesn't include just food. It includes food at the right times, in the right amounts, and of the right consistency or character to maintain wellness. Just like you said, you go to a farmer's market and there's food left over at the end of the day, and yet we have people going hungry. And that, I assume, is actually where a lot of your focus is trying to meet those, bridge those two together. Where is the food supply, and how to get it to the individual. I'm actually just
Absolutely.
supposing that. I'm sure you do a lot more than that, but
Yeah. Well, kind of I see our work as being two big buckets. And one is we are a food distribution company. Last year we distributed 17 million pounds of food all over Vermont. And that means we have distribution centers, we have huge, freezers and coolers, and we have forklifts and we have trucks. One just drove by right in front of me, going out and making deliveries every day. And the other part of that is the kind of the policy side. What are the federal and state policies that are supporting people? What's happening in the world of healthcare? You mentioned I'm on the board of One Care Vermont, which is trying to figure out kind of coordinating our healthcare system in Vermont in certain ways, and how do we do value-based care as opposed to fee-for-service care, and what does that look like? On the policy side, how do we, diabetes is a huge issue, affects the quality of life of people tremendously. It's a cost driver, and it's something that can be turned around with diet for type 2 diabetes. I don't want to let the type 1 diabetes folks out there know that I understand that difference. But how can we as an organization, as the food bank, make sure that people with low incomes who are diabetic or pre-diabetic have the food package that they need for foods that they want to eat that are going to help keep them healthy?
So what do you see specific, maybe more to Vermont, the causes of the hunger and in the populations, at least, that you work with and your organization works with?
Yeah, it's the economy, and Vermont, is different than other places in that we're very rural, and the real economic growth is focused in very specific communities. I mean, most of it obviously is in Chittenden County and the surrounding areas, north of there in Franklin County. And, and then the bigger cities, Brattleboro and Rutland and Bennington. And there are a lot of very, very rural places where there aren't many opportunities for gainful employment, and people travel long distances. I'm fortunate in the food banking world that we have a national network. And so I spend a lot of time talking to other food bank leaders who have similar area types of populations that they're serving, and reaching people, rural isolation. I guess what I'm trying to say is something that's different in Vermont, particularly for our older Vermonters. Rural isolation has huge impacts on people's ability to access food and be healthy by eating. So I think that, our rural economy, how the economic growth is really concentrated in certain parts of the state. And then just that isolation of some of the regions in our state are kind of the unique things that make addressing food security a challenge here.
So it's back to that distribution part we were talking about, which is why you have those forklifts and trucks, which I've got, of course, in my mind, these huge forklifts running around and lifting up food. And maybe that's correct. I'm not
That
sure.
is correct.
So what do you see then as, current activity, the most pressing projects that you're working on now?
Yeah, right now, I think we're trying to, like everybody, we're trying to figure out what is the new normal going to be, since we've entered this age of the COVID pandemic and now endemic. It turned, like the healthcare system, it turned our whole world upside down. We were doing distributions, literally touching people every day. Food shelves where people were walking into small confined spaces and picking out the food that they wanted and needed. And overnight that flipped over to cars driving up and being given a bag of pre-filled food. things like Instacart and Uber Eats have taken off. And so there's food delivery. Well, how do we provide that kind of service to the people that we're serving, who maybe can't afford to order Instacart, but maybe don't feel safe going out? So we're working on integrating the new technologies. But really, I think it's how do we kind of live into this amazing shift that's taken place in how we do our work.
Do you run into problems much with negative stigma and people not wanting to reach out in times of need?
Absolutely. It's actually one of the things that COVID has had a big impact on. We noticed, particularly early in the pandemic, people were rightfully terrified. They didn't know what was going to happen. People were scared to leave their homes. You may remember the long lines of cars waiting for food at state airports around the state. That was the Farmers to Families food box program. And just the fact that half of the households in the state were somehow impacted by COVID, their jobs, people lost hours. Parents had to quit jobs to care for kids because schools were closed. Just the disruption was incredible. And a lot of people, I think that stigma was put to the side. They said, okay, this is a crisis. It's okay to reach out for help. And our experience has been, as things have slowly changed more and, businesses have opened up, people have gone back to work, that a lot of folks who were probably on the edge anyway, I'm eating ramen noodles 3 nights a week because I really can't afford all the food that I want, but I don't consider myself food insecure. That those neighbors are seeing now, wow, I can go to a Veggie Van Gogh and I can get some fresh vegetables to supplement my diet. And I can go to the food shelf and get some staples and then go to the grocery store and spend the money I do have on fresh food or meat or other things that I want. And I'm happy about that. I want people to be making use of the resources that are there. But I think we're going to continue to see these folks kind of that the stigma got rubbed off a little bit, continuing to come in. The other thing I want to mention is school meals. So for the last couple of years, because of federal waivers, we've had universal school meals across the country. So any child that goes to school right now today goes to the cafeteria and eats. Some kids get free meals, some kids pay for meals. And there's actually a bill in the legislature to make universal school meals permanent in Vermont. What we knew from data and what we learned from experience was there's tremendous stigma in the food school programs. And making school meals available to everyone all the time eliminates that stigma. And you're talking 2 meals a day for, every child probably from age 7 through age 17 or 18, and nutritious meals. So, that's something that I think we can't underestimate.
Yeah, the stigma is such a barrier in so much of health and healthcare. And that's why I asked. I assumed it was a barrier that you face as well. And then you brought up the good example of in schools. I certainly remember going to school and it was pretty public who was on assistance and who wasn't. That's unfortunate. You talked about those the pictures in the newspapers of the long lines towards the airports. One was in Bennington and in other parts of the state. And I think that really did hit people hard. They're just not used to seeing hunger, at least, of course, on that scale, but even so visibly in the United States. But that actually shows that the problem is generally hidden, except during this time of the pandemic. And now that those lines don't exist anymore, probably to the general public, perhaps even some of this audience, they don't really understand that there is still a problem. And again, thank you to your organization and others for working on that. Specifically, during your time, you said you've been there since 2009. Do you have any great success stories, or do you have something you consider your biggest success?
Absolutely. I think our biggest success is how we've incorporated fresh foods and particularly fresh local foods into our services. When I started at the food bank in 2009, we had just started really doing fresh food, and just started a gleaning program where we're working with local farmers to bring Vermont produce into the system. I think in 2009, maybe, I don't know, maybe 50,000 pounds of fresh produce went through the food bank. And now, out of 17 million pounds that we distributed last year, 61% of that was fresh. And so
Wow,
we've
that's
just
great.
completely transformed. And so it's a whole different business, moving fresh food, whether that's meat or fresh produce. It has to be handled differently. It has to be moved very quickly. And you want to make sure that it's getting to people in a state where it's, attractive and still has its nutritional value and tastes great. And so our ability to do that as an organization, just starting our Veggie Van Go efforts, because one of the challenges with distributing fresh food is when you're using the food shelf system, there may be a food shelf in a small town that's open for 2 hours a week, and timing the delivery of fresh food so that it's there and that they have the proper equipment to store it and distribute it is really, really difficult. And being able to do these farmers market style fresh food distributions statewide directly has given us the ability to distribute vastly higher quantities of fresh food. And then it gives us the ability to work with local farmers. So now we actually purchase first quality produce from local Vermont farms and get that right into that farmer's community for the people who wouldn't otherwise have been able to afford that. It's changing palates, it's changing diets, and it's supporting our local farmers, some of whom during COVID, we were a lifeline because we were still buying and the restaurants and schools and institutions weren't.
Right. That's great. I was just thinking as you were talking, and with the previous question about how the problem can be hidden. I mean, it is very true. We've made considerable progress in the country over the past, century. We don't see diseases such as pellagra and other, vitamin deficiency diseases, but that doesn't mean that we're not seeing health effects due to poor nutrition. We most certainly are, and it's sort of moved from a lack of calories more to the wrong types of calories. And I know that's something that your organization and probably even have a specific department that may be focused on that. How do you keep your team motivated, or how do they stay energized towards the mission of the organization?
We're really fortunate to have a great mission that just does energize people. People come to work at the Vermont Food Bank because they care deeply about our neighbors having enough of the right foods to eat when and where they need it. I think the way we keep people energized, because it can feel sometimes like a challenge. How do we really solve hunger?
Right.
We stay energized really by getting energy from the people that we serve. Hearing their stories and sharing their voices really with people in the community and with each other. And we, like every place, we try and have some fun. The last couple of years have been really, really hard. Like folks working at hospitals, our team are very tired, and we've been running on adrenaline for 2 years now. And it's
Sure.
we have to figure out how we're going to keep up the energy level. So now we're warm weather's here. We like to get together, get outside, play games, listen to music. We like to learn together a lot. We have a lot of opportunities for the organization to get together to learn about, well, we're doing a lot of work on equity, as lots of organizations are. But also we have book clubs where we read books together and then have discussions, and we just a week ago rolled out the barbecue and at lunchtime do some grilling and getting together. So just kind of those usual things, human interaction, and always focusing on the stories of the folks, the neighbors in our community that whose lives are enhanced a little bit by the work we do.
Well, certainly, as you mentioned, the mission in itself is compelling, and that probably helps drive a culture. And then along with, your leadership and the leadership of others, I mean, that's how you motivate and inspire people. And that's how we get better outcomes. So thank you again, and thanks to your staff and everyone. As we're sort of finishing up here, what can folks outside of the Vermont Food Bank, who maybe not even familiar with it, do to help and support the work you do?
Yeah, thanks for that question. So, there are a couple things that people can do. The first one is just be aware that hunger exists in our community. As we talked about earlier, that awareness has increased dramatically with COVID. And that's true across the country and probably across the world. But remember that hunger was here before COVID at unacceptable levels in this state, and that it is something that we can change. We can do something about it. So be aware and advocate. When you hear something happening in the legislature, like right now, they're working through a bill on universal school meals. Contact your state legislators and let them know that you support S100, which is the universal school meal bill. And then, also financially support the Vermont Food Bank and the local organizations in your communities. We are not a government-funded organization. We are a 501c3, and we're one of those nonprofits that doesn't have much in the way of revenues. So we rely on donations, and pre-COVID, it was about 70% of our funding came from individuals and small family foundations right here in Vermont. Obviously during COVID, it's been an extraordinary time and extraordinary response, and we've gotten a lot of assistance from the federal and state government, and we're grateful for that. And then volunteer. We love volunteers. I know the folks at the hospital were volunteering at the Veggie Van Go when we were able to do it there, and we look forward to getting back to that. And there are opportunities in communities all over Vermont, and you can learn about those if you go to our website, which is vtfoodbank.org.
Well, thank you. John Sales is the CEO of the Vermont Food Bank. We really enjoyed having you. Maybe we'll have to get you back on the show in 6 or 8 months and get some follow-up.
I'd love to do that. It's a pleasure being with you. Thank you.
I'll also thank Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Healthcare, Ashley Jowett from Southwestern Vermont Healthcare. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity, and we'll see you next week.